Welcome, everybody, to the Quality Reviews webinar series. My name is Edward Shin, and I'm the CEO, co-founder of Quality Reviews, and we are a digital patient engagement company that have a set of real-time digital solutions that map to the patient journey to help the patient-provider communication. It is my pleasure today to welcome my really good friend, Dr. Barry Chaiken, to the show. Barry is a really good friend of mine. We go back a long ways, and he is not only a physician, board certified in preventative medicine and public health, he is also an author, and he has written a book recently and published a book called Navigating the Code: How Revolutionary Health IT Can Transform the Patient-Provider Journey. Dr. Chaiken, or Barry, as I like to call him, is an experienced leader in health IT and has worked for businesses such as Infor, Tableau, and Pegasystems, and is also a professional speaker on the healthcare conference speaking circuit. So welcome, Barry, to the show.
Thank you, Ed, for that really nice introduction, and it's wonderful to see you again.
Thank you. So this book, I'm so glad that you wrote it, and I would like to know what prompted you to write the book?
Well, for the last 20 plus years, I've been writing articles on health information technology for various industry magazines: Patient Safety and Quality Healthcare, Becker's Health Review, Health Data Management, and a variety of others. And when you do that for that amount of time, what you've done is you've spent all that time thinking about the issues around health information technology, in my case, because that's what I was focused in on. And then I got to a point and I said, I really need to share what I've thought about with a wider audience and put all of the concepts together in one place so that people would be able to learn from them, debate them, argue with me about them, but at least start that conversation going. And one of the other things I did is I didn't want to write a textbook. I wanted to write a book that somebody would be able to read on the beach in the middle of the summer, if it was a nonfiction business book. And that's essentially what I tried to do, because I wanted the concepts to be measurable for people and meaningful for people that they can use. Because one of the most important things you do when you're a speaker is you realize that the most important person in the room is the audience. Right. So when I wrote my book, I said, the most important person in this book is the person who's holding that hardcover with the pages and reading it. And I wanted to make sure it was interesting, entertaining, and informative at the same time. And I'd like to think that I achieved that.
Great. Thank you so much for writing the book. And let's get into the book a little bit. You've outlined the book in 5 main parts, and I'm just going to go through them very quickly. And then I wanted to just focus, and we'll jump from part to part. But part 1 explains the depth and breadth of healthcare's problems worldwide. Then its issues with technology, change, and business management. Part 2 represents RHIT, or Revolutionary Healthcare Information Technology, as the essential tool for change management and the transformation which accrues from it. Part 3 develops a deeper, more encompassing understanding of change management. Part 4 explores the application of RHIT and its transformational impact on the Hippocratic Code of Quality, Access, Outcomes, and Financial Investment. And part 5 draws everything together. So I'll turn it back over to you, but walk us through how you mapped out this outline, and then really wanted to focus on parts 2 and 3 in terms of the change. So I'll hand it back over to you.
Thanks, Ed. Well, there are 2 key pieces that, or I should say tenets, that I wanted to put in the book. The first one is that I wanted people to be able to read it, which, as I've already mentioned. I also wanted to make sure that the book was something that people could actually use. And there's a third, which was I wanted the book to be something that anyone, wherever they were in the world, would find value from it. Oftentimes, books like this are written where it's all about cost and the American healthcare system is bad and we spend too much money, and a lot of negative in it. We got to fix this and we fix that. I didn't want to do that. So I don't even talk about cost in my book. It doesn't mean I don't address it, but I talk about value you get from the resources that you devote to delivering healthcare. So if you're in the UK and you have a national health system, anywhere else you might be in the world, it doesn't really matter because it's really all about value. And that's what I talked about in the book when I was talking about quality, safety.